Well, tonight we want to talk about the confusion over the COVID vaccine. The FDA approved this year's vaccines for adults 65 and older and those who are younger and have certain medical conditions. Well, that is sparking concerns that it may limit access. Our Logan Gay has been talking with healthcare professionals about these recommendations.
What used to be a straightforward and standard process has become a bit more complicated for many people. The COVID-19 vaccine was once available at no cost to anyone who wanted one. It is now seemingly only available for those who qualify or who can pay for it. Earlier this year, Health and Human Services Secretary Robert F. Kennedy Jr. fired the members of the CDC Advisory Committee on Immunization Practices. The group develops recommendations on how to use vaccines, but the executive vice president of the Indiana Pharmacy Association, Darren Cummington, says the new members haven't weighed in yet.
Well, ACIP hasn't yet set those guidelines for these new vaccine approvals for COVID. And so if a pharmacy is relying under the legal authority of the health commissioner's order, they're probably waiting until those guidelines are established or otherwise requiring a prescription in the meantime.
The shots can cost $150 or more without insurance. The big question is who's going to be responsible for paying? Covington says that's up to insurance companies.
Now that FDA has changed that, it's not yet clear if all insurance companies are going to cover the vaccine if you don't fall into one of those two groups.
Pediatrician Dr. Eric Yancey worries how the uncertainty may impact patients.
The scary part is that there will be a number of families who just can't afford to spend that amount of money on the vaccine. That's why the vaccine programs have been put in place in the first place, to actually make sure that children who are underprivileged and underserved can still get vaccinated.
Regardless, he suggests all Hoosiers do what they can to make sure they can get the vaccines they need.
That was Logan Gay reporting for us. Health experts say, here's the main message. If you want the COVID vaccine, you can get it. You may need a prescription first. They say the first step is to talk to your doctor and make sure that you go over what his or her plan is for you.